virtually. Can all board members please identify themselves for the record?
Sal Migliori.
Stephen Arusa. Chris, we'll wait a couple minutes.
Yeah, let's wait a couple minutes. I think some folks are still trying to log in.
Roger that.
Hi, did somebody just join?
Yes, Karen Collins.
Hi, Karen, how are you?
I'm good, thank you.
Okay, do you think we're good to go, Chris?
No, we still need to wait for Kyle to join and Dr. Parikh as well.
Yeah, I think we just got Dr. Parikh.
Dr. Parikh, are you there?
I'm here.
Great. Chief, we have a quorum if you would like to proceed forward.
Okay, great. I would like to call the December 11, 2020 Fisher's Board of Health meeting to order. In accordance with state and local guidelines regarding COVID-19, we are conducting this meeting virtually. Can all board members please identify themselves for the record? Steve Arusa.
Sal Migliori.
Karen Collins.
Vishal Parikh.
Can all staff members identify themselves for the record?
Monica House.
Josh Robinson.
Lindsay Downing.
Chris Greisel.
And Tracy Gaynor.
And I see we've got Ashley on here too. Okay, we have 3 items on the consent agenda today, which consist of meeting minutes from October 2nd, 2020, November 10th, 2020, and November 13th, 2020. Do I have a motion to approve the consent agenda?
Motion.
Motion by Sal, second by?
Second.
Second.
Okay, I think we have a motion by Sal, and then Dr. Parikh.
Yes.
All those in favor say aye.
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 Any opposed? Okay, the motion passes. I'm now going to turn it over to the city's public health director, Monica House, for a presentation to the board. Go ahead, Monica.
Hi, everybody. I'm going to be sharing a screen here. And we are expecting Dr. Lane to join us as well. I will be giving part of the presentation. The other part will be given by our epidemiologist, Josh Robinson. I'm here with him today. Can everybody see that?
Yeah.
Yeah, okay. All right. So today it is December 11th. And the objectives of this meeting are to kind of go over the actions and recommendations and orders that we've made in the recent time period, really in the last month or so, and the results of those recommendations, orders, and actions, review the data where it's at right now as far as COVID goes, and discuss those projections. Talk about some of the current orders from the state, as well as some in our region, discuss our next actions, and then discuss potentially increasing our meeting frequency as well. So just to recap a few things that have happened in the past month or so, one of the things that we know that works best for preventing the spread and transmission of COVID is really the masking, distancing, sanitizing that we all know about and that we've been talking about for many, many months. But we hadn't had a concerted, coordinated advertising campaign and real push on this front, in the way that we would need to do in order to really get that message across. So that campaign, the Every Actions Count campaign, started, I'm saying November 11th. I remember filming a video for it on that day. And that we have put a lot of social media posts out there. We have them many times a week with this messaging. We've had video spots. We've had print advertising. We have a weekly newsletter that's going out. We also have gotten together with some of the other officials in the area. We've shared this campaign with others as well, and so that was a big concerted effort to try to get the public on board and make sure that the messaging at least was out there. There really should not be any reason at this point to not know what to do and what the recommendations are from a personal action standpoint. Following that, and after our last board meeting, we implemented some new public health orders. We tied them to the governor's orders so that we didn't have to repeat all the same language, but then we put some additional restrictions on regarding indoor social gatherings, which were limited to 10 persons without approval, and outdoor social gatherings limited to 25 persons. And then people could submit for approval through our web link if they were planning to have a larger gathering. We were requiring approvals for all extracurriculars and events. We said at restaurants there could be no bar service, no service at the bars, and they had to be seated 8 people max per table, and then two people maximum in the lobby. That included a renewal of the mask mandate following the governor's mask mandate as well, with language tied in. And, with the exception being that ours is for children 5 and up versus the governor's, I think, is 3rd grade and up. So those are the orders that we put in place on November 18th after the last board meeting. Since that time, we've also been aggressively, I would say, following up on complaints, reviewing a lot of requests for special events and for other events and for extracurriculars and sporting events. We've been conducting spot checks in the community, going around to a lot of our businesses and popping in, checking to see the compliance rates for COVID. We've conducted, or had the other day when I collected these numbers, 56 complaints in the month of November and into early this week by our inspection team. We've conducted more than 60 spot checks. They're trying to pop in to a number of places every day. Our inspection team has started working evenings and weekends to make sure that they're checking in on some of these places that wouldn't potentially be problems on nights until nights and weekends. So they're able to pop in on those places and do those spot checks on more appropriate schedule. We've had and processed 98 social gathering and event approval requests during that time as well. So our team has been quite busy. They haven't seen a lot of egregious things, and when we've gone in to follow up with the complaints, although there are suggestions we can make, there haven't been, I would say, gross infractions. The same with the spot checks. By and large, most places are very compliant. When we've gone back for the places that maybe had some issues, they were in compliance, and it's been very few. So again, we wanted to make sure that we are doing every possible thing to say we're doing all that we can to make sure that these things are happening and to make sure that everyone, from what we can see, is in compliance and give our community the best chance to, potentially make this impact and see if we can't make any kind of impact on getting these rates under control. With the rates continuing to go up over that time, we then issued a public health alert on December 4th with including some of our data as well as some forecasting data about the situation and how much it is increasing. The rates are increasing, the forecast for cases are increasing, the forecast for deaths are increasing. And along with that data and forecasting, we also provided some additional language for personal action recommendations. It was not significantly different than what we've been recommending all along, but we wanted to kind of increase the strength of messaging around this. Yesterday, our public health orders that we put in place after the last meeting were set to expire, so we renewed those as of yesterday. So there were not any changes to that renewal order. We had set them to expire just after Wednesday in anticipation of the governor giving his press briefings on Wednesday and wanting to make sure that we were in line with any other changes that might take place from the executive orders from the governor. So those are the activities that we've done. So we've been quite busy, and I'm going to turn it over to Josh for a bit to describe the current situation with COVID.
Thank you, Monica, and thank you to the board members and everybody that's online for having us today. So I'll quickly run through our COVID updates and some forecast models that others have developed. To start off with, we updated our dashboard this morning with a new line list of COVID cases from the states, and our totals have increased to 5,455 cases. When you look at the graph of cases by date, the confirmed positives, you can see our 3 highest daily cases within the preliminary period, the gray bars down below on the left. And that's, sorry, I just need to move this part here. We experienced our highest percent positivity for unique individuals this week, and this is the Hamilton County metric. It was up at 24.7. Today it's down to 23.1. We also had our highest case incidence rate, 14-day rolling average per 100,000. That reached 101.98 this week. We have unfortunately lost 46 community members to COVID thus far. I am trying to advance the slide, but it isn't. Sorry, apologies, just one moment.
Sorry.
Here we go. So if we look at our COVID cases over time, this figure will show you the confirmed, and then starting in July, confirmed and probable cases over time. Since we started tracking this in March, we'll see 2 periods of decline, so May and June, and then again in September. And you'll hear me use a fire analogy throughout talking about the data. When we look at October, we started seeing a rise again, so a brush fire beginning in October. We ended that month with 667 confirmed and probable cases. Unfortunately, that brush fire was untamed, and in November, it turned into a wildfire, where as of now, we are up to 2,311 cases, I believe. There's still a possibility that updates from the state will backfill additional cases in November. And then here in December, you're seeing that we're up to 752 total cases so far in December. That includes preliminary data. In the first full week of December, we saw 682 cases. Again, that's preliminary numbers. Those will increase as we get more reporting from the states. And we're currently experiencing a bit of lag in reporting in terms of backfilling those numbers. Next, we have a figure that shows us the cases by age group and then the age-specific rate per 1,000. This is based on U.S. Census estimates for fishers. We see the highest rates per 1,000 in the 20 to 29 age group, that's 99 per 1,000. Next highest rates are in 40 to 49, and the third highest rates in the 80 plus. Here's figure 3 showing you the confirmed and probable cases by gender and age group, and then the age-specific rates for males and females, again based on the same census data source. And we see the highest rates for both males and females in the age group of 20 to 29, 121 per 1,000 for females, 81 for males. The next highest groups for females is 80 plus, and then 40 to 49, and males is 40 to 49, and the third highest is 50 to 59 and 60 to 69. So figure 4 and 5 that you see here shows you confirmed or probable COVID cases by race ethnicity estimates, and then presentation with COVID symptoms on date of positive test for confirmed and probable cases. Both of these are estimates based off of data that we collect at our Fishers testing site, where we collect a slightly more level of granularity in data. So we understand roughly about 33% of our cases are testing positive through our site, and then this is just producing estimates for all of the known cases here. So I won't go through these two figures in tremendous detail because you'll have availability for this, of the slides. But I will talk a bit about figure 5, where it is presentation with COVID-like symptoms. And we see a majority of people getting tested with no symptoms, and the next highest group is those presenting with one or more symptoms that may be potentially consistent with COVID. However, we are seeing 1,354, that's the estimate of people that present with symptoms that are consistent with COVID. So they're getting to a point of testing when they have symptoms that are consistent with the disease, and then 154 people that present with severe symptoms. So we'll switch gears a bit to COVID projections. This is the Institute for Health Metrics and Evaluation. It's a projection that you've probably heard talked about in the media quite a bit, and also seen in other news sources and other individuals talking about it. So the IHME model, this one is projecting out deaths across the U.S. At this point in time, I pulled this 2 days ago, and it's projecting all the way up until April 1st, 2020. So the red line that you see, the red line projection is if mitigation measures were eased. The purplish line is the projection of where we are if things stayed the same. Rapid rollouts is the blue line that refers to if there's rapid rollout of the vaccine as currently planned. So if that kept up to pace as currently planned. And then green line is if we reach 95% adherence and fidelity to individuals wearing masks. Just quickly on this, I know that there's a lot of discussion about and a lot of excitement for the vaccine, rightfully so. But by April 1st, the difference between projected deaths and rapid rollout of the vaccine would save potentially 11,000 lives compared to April 1st projected and 95% mask compliance. If we had 95% mask compliance, it would save 66,000 lives across the U.S. This is the same model projected out for the state of Indiana all the way up until April 1st. It's projecting 10,493 deaths for Indiana. And you can see a difference between projection and vaccine. That's right in the two trend lines right in the middle. There's not very much difference, indicating a bit that the vaccine rollout will only save a few lives in the state. It could potentially end up saving more than this projection. But that masks, again, show that would have a higher impact on saving lives up until April 1st. I also wanted to share with you some projections from the CDC. So the CDC collects models that are put out by different organizations and groups across the U.S., and they create what they call an ensemble model. So the two figures on the left show you the range around the projections for weekly deaths and total deaths up until January 1st for the state of Indiana. And you can see a wide variation across these models. The two figures on the right show you the ensemble model from the CDC. The top right shows you the new weekly deaths and then the range based on the other models. The lower right shows you the total deaths by January 1st, and then the range again. Research has shown that using the ensemble model projections the CD has done for both COVID and then for other diseases has been slightly more accurate than any one single of these other models. So this brings us into COVID projections for Fishers. I apologize, this figure is titled Figure 1. It should be Figure 6. But these are COVID cases by 7-day period, and they're projections by our individual Fishers estimated effective reproduction number using a simple ratio. That method has been shown to not differ too terribly from more complex infectious disease modeling. But here I wanted to share with you how our model for future cases looks like. So this is a 7-day period. The first column you see on the far left is the 7-day period ending on December 1st. Our model is projecting roughly 686 cases for the week ending December 1st. That would bring a cumulative death to 47, and then that's the blue trend line. The gray line shows you the deaths that could be attributable to infections for that 7-day period. So 7 new deaths attributable to those 686 cases. And then this is modeled all the way out by 7-week period through February 2023. And you can see week over week, the cases gradually increasing. Clearly the number of deaths, cumulative deaths, which is the blue bar, increasing over time. And you can see the individual contribution of cases for any given week in terms of new deaths. So how are we doing with our projections against hard case data that we get from the state? Right now, I can't give you the definitive answer on exactly how well we're doing with this projection. Our most recent line list from today includes cases reported as recent as 2 days ago, so Wednesday. This includes a preliminary period. The 7-day period ending on 12/1 from their line list shows 567 cases so far. So that 567 number is slightly below the 686, but that we are in a preliminary period where we're likely to receive notification of cases during that week ending December 1st. I should have ability to more confidently adjust our model sometime next week and look back and see how our projections are faring against actual cases and then adjust that moving forward. Irrespective of those adjustments, I think we have enough confidence to say the trend is going to be the same, that these cases will increase week over week, and you'll have associated deaths with those new cases. So we've been discussing a lot what we can do to help continue to reduce the spread of this virus in our community. And this figure here is showing you a range of, well, actually 2 different options that we've modeled out. So we looked across the evidence base and then modeled our projections on implementing different non-pharmaceutical interventions within the community and how that would impact the cases and the associated deaths with those new cases. Modeling it after what is called a susceptible infectious, or susceptible exposed infectious and recovered model. It's a compartmental model in epidemiology. So you'll see the blue cases. The model starts at an even point for both types of interventions on January 12th. That is assuming if new measures went into place on December 29th, we would roughly need approximately a 2-week lag period before we start to see any effect from those new measures. And that brings us forward to January 12th, where projections would be roughly at the week ending of that time period around 1,100 cases. If we implemented a range of different options to impact movement around the community, that is the blue trend line and then the blue bars. If there were a situation where we could get up to 95% mask adherence and strict physical distancing among individuals and had a brief fire break, stay at home or shelter in place order put in, that's the gray bar, and its impact on the cases over time and then the deaths from that type of order is shown with the black trend line there. And I'll switch this back over to Monica.
So I did want to cover what our governing bodies are telling us we should be doing in this situation. So the CDC came out with recommendations. The formal date on those recommendations is today, but they were released in a preliminary stage last week. And to summarize those recommendations for what are the public health strategies we should be using to address these high levels of community transmission, which is the whole purpose of this document, here's their recommendations. They recommend physical distancing and limiting contacts. We've been talking about that for a while now, and we've done nearly everything we can think of in those categories to encourage that in every way and to put in place different processes and messaging and everything to do those activities. Their second recommendation is to avoid non-essential indoor spaces. So that is one of the reasons for having those limits on indoor gatherings. They also suggest avoiding crowded outdoor spaces. Again, those limits for gatherings, those limits on the events and social gatherings that we have in place are intended to follow those orders. They recommend increasing testing, diagnosis, and isolation. We have worked very hard to continue to increase our testing capacity. I think our capacity is quite high. It's not being utilized this week very much for some reason that we have yet to put our finger on. But we certainly have a very high capacity for testing, and we continue to increase that. We continue to recommend isolation and quarantine under the CDC and ISDH guidelines as well. They are also recommending prompt case investigation, contact tracing, and follow-up. We've been doing this since April. I don't know of any other organization in the state that is doing it really at the level of activity that we are as far as the contact tracing activities go. The state recently also changed some of their processes, which should help speed up some of their times on that end as well. But we're pretty maxed out as far as following this guidance. There's not a lot else we can do because we're already doing the max. They also recommend protecting the vulnerable and essential workers, such as promoting telehealth options. So businesses having their employees work from home. We've been talking about that for some time. Offering protected hours for vulnerable and essential workers is another idea that could be put in place. And then no contact options, so promoting curbside pickups and that kind of thing. CDC also recommends postponing travel. That's not something we can really regulate as far as, preventing our citizens from traveling, but that is another recommendation. And then they have recommendations about increasing ventilation and sanitation, all of which we've been continuing to promote actively in our recommendations that are published and in our discussions with all events and businesses and all the other places that we speak with. The State Department of Health also has recommendations in their public health orders for what should happen based on what county color code is assigned for that week. And I just want to take a second to discuss why I have this all red state map up here. This is the map of the state based on their case incidence rate calculation. So if you go to the state website on their dashboard and you select their metric category, which is the one it defaults to, there's an option to select the percent positivity rate or the case incidence rate. So this is, if you select the case incidence rate, this is what you will see. The whole state is in the red category on that metric. The only reason the state is not completely red on the primary metric that they use, where they average the case incidence rate with the percent positivity rate, is because they're using an all-test positivity rate, which is not the best measure of the true infection rate in our community. It is going to be falsely decreased, and I'll show you that map and where we're at here in a second. But this really is a truer picture of where the state is at, and I think we've seen that in the national media being widely reported as the worst state in the country right now for COVID spread. So under the state's recommendations in their executive orders, the last couple executive orders, and they're repeated in this one, what they recommend that the counties and local jurisdictions do in the setting of orange and red, if their county is in orange or red on the state's metric, they suggest that we evaluate the source of positive tests and conduct targeted testing. I would say that we do a fair amount of evaluation of the positive tests. We do have mapping capabilities, and we do look at, kind of targeting communities where we see an increase, and we do actively engage with those kinds of things. They also say that they will convene local officials and key leaders to discuss a strategy. We have not yet been contacted by the ISDH. We've been in orange for a couple of weeks on their metric, so I'm not sure of the process for that. They suggest that school officials should review plans for extracurriculars. We are actively doing that under our public health orders that were issued at after the last board meeting. So we are assisting the schools with those and in fact requiring that we be part of that review process. They also say once the county hits red on their official metrics that we should be considering limiting hours for bars, taverns, restaurants, and nightclubs. So that is what the state specifically spells out in the executive orders. So this is the picture of where the state is at on their current metrics. They update them every Wednesday at noon. So this was yesterday's updated map, and you can see that it looks a little less scary than if you use a case incidence rate map. But nevertheless, it doesn't look good. And we I should say, even our all test percent positivity rate is rapidly rising. It's about 13.5% today, but it's once it hits 15, then Hamilton County will also be in red. As far as the orders that have been put in place, I just wanted to review a couple of those. So the governor on his update on Wednesday mentioned new executive orders, and we were able to see those in print yesterday, where they, again, go through the county level risk rating. There were a few slight changes and differences from the previous set of orders that were released. So probably you have heard on the news about the limiting surgeries that are not essential. So that was one of the parts of the orders. The others really are capping event sizes for both inside and outside events, and not just social gatherings, but any kind of event. So any kind of activity that is gathering people in any way, fairs, festivals, all of them have strict cap limits now. And so when the county is orange under the governor's orders, those are strictly capped at 50. And when the county is in red under the governor's orders, those are strictly capped at 25. So it is not possible to have a social gathering or event at any with any amount of people more than outlined here, with exceptions of the sporting events. So the sporting events have to meet capacity limits under orange, and then they can only have, I think, just parents and siblings, I think, under the governor's orders for when they're in the red category. So I should be more clear. There are some specific exceptions for K through 12, so I'm not putting all of that in here. Those are all laid out under the governor's orders, but the specific differences that came out yesterday were the surgeries and then the event size caps. Hamilton County also put out some orders a couple of weeks ago for when the county is in red. So theirs have not kicked in yet. The orders specifically are, should the county hit red, then this was their intention. I'm not going through all of the orders that they put in place. I'm just kind of picking out a few of them. Some of their orders assumed a larger event size cap than what the governor's orders have put out. So that's why I'm not going through them. Basically, they said that bars and restaurants should be closed from 12 to 5 with a max of 6 persons per table, and that we should have a 50% capacity limit on bars, restaurants, gyms, and non-essential businesses. They're pretty spelled out. They also were requiring masks for all persons ages 2 and up. And again, they have spelled that out in a lengthy document, as all these orders are. So our actions to take now, I guess what I want to impress on you is that we have pretty much gone to the bottom of our toolbox at this point. We have done all of the asking. We have done all of the requesting. We have put in place some orders to try to encourage people to behave responsibly. And what we're seeing, and I know Josh mentioned that if we had 95% mask compliance and strict social distancing, we should be seeing a decrease in our curves. And what we're seeing is that that's not happening. So even though we go out to our, stores and look around the community and we see that, people by and large are following the mask orders when they're in those facilities, clearly those are not being followed by and large in the community, or we would have seen a drastic decrease in our cases by now. So something still is not working, and we're nearing the end of our toolbox. So what we are planning to do is to make some triggered orders based on these metrics. We've tried to keep them in line with our state and county partners as best as we can for consistency's sake for our residents. What we're planning is that when the county hits red on the state's metrics, and I've kind of broken that out to about what that comes out to on our metrics for people that are following our metrics. The state says case incidence rate of more than 200 per 100,000 per week, and 15% on the all test rate for the county. What that works out to for us is we're well exceeding that on a case incidence rate. And then the all test rate is that one thing that's preventing the county right now from being in red on those metrics. So at that point, we would order that above and beyond the state orders, these measures. And these, again, are fairly consistent with what Hamilton County is doing, just for lack of confusion for our facilities that are located in the area. Where they're different, we have little stars to indicate them. So a 10 p.m. curfew. The retail capacity would need to be limited and metered. So the metering would be slightly different than Hamilton County's. The extracurricular events and sporting events would be limited to one viewer per participant, and there should not be any social gatherings or events happening at that point. We would also recommend offering protected hours for vulnerable individuals. We've been recommending that for a long time, so I would encourage all businesses to continue to do that. And then at some point, should the need arise, we need to plan for a 2-week fire break. So we have used the trigger of the ICU bed capacity of dropping below 15%, because that is an easily available figure that is easily accessible to find by both the public and by us. It's reported on quite regularly on the State Department of Health website, and that indicates that the hospitals are really in a critical stage where they're going to need our help to curb the spread of this, so that we can stamp down that curve and get ahead of this. We are also proposing that that we consider meeting a little bit more frequently as we're heading into this kind of dire period in our history, waiting for the vaccine to roll out. So I am going to stop sharing my screen for a sec and see if I can find you guys. I don't know how to do that.
Stop sharing.
I did. Have I stopped sharing? Okay.
Yep, you're good. Board members, do you have any questions for Monty?
And I think Indy's on the line now too.
Hey, good afternoon, everybody.
Hey, this is Sal here. The masks work by preventing the transmission of the person who has the disease. Did I understand that correctly? Is that the way the mask works? It doesn't work by you. Like if you have the COVID and you have a mask on, you're limiting what you can spread. that correct?
I think it's actually twofold. So there is some more recent evidence that shows that it also protects the wearer as well. Maybe not, so it is really important that both parties continue to wear the mask.
Just to add on to that, Sal, the scenario you're describing is what's referred to as source control. So if you have an infectious person who isn't wearing a mask compared to one who is wearing a mask, the infectious person with the mask on is less likely to spread it to other people. So the role the mask plays for that individual is as source control. For people who are not infected with whichever disease you're looking at, and if it's communicable through the air, the mask provides a protective effect to them. So there is a robust evidence base about source control protection from masks, as there is also for the protective effect of masks for wearers.
But more emphasis on the person who has the disease.
No, I would caution that type of statement, because we do know this evidence base exists to show that it's masks, particularly N95 masks and surgical masks. There's emerging evidence on cloth masks, but those are so variable that the evidence base for a different variety of cloth masks isn't as robust as the others. But there is a robust evidence base that masks provide both protective and source control protection. So not just for individuals wearing it, but for individuals who have yet to contract whichever disease you're talking about.
The reason why I ask is because it's going to be difficult for Fishers to create a moat around itself. Everyone I see is wearing a mask. Our numbers are going up. So at some point, you have to scratch your head and say, what's going on here? You can mandate everyone in Fishers to wear a mask, but you can't have checkpoints at every single entrance to Fishers on people coming from outside of Fishers, or you can't have people who are driving outside of Fishers who come into contact with someone. So I guess I'm just trying to help me understand this mask and why the numbers are going up.
I think that's a fantastic way for us to just think about this. So right now we're looking at our effective reproduction number for Fishers at about 1.08. That's slightly below Hamilton County, which last time I looked at is 1.09, right? If that number were below 1, you'd see a decline in the spread of whichever virus that you're looking at, right? Ours is above 1. Anecdotally, it's easy for us to look around our community and say, we see a decent level of mask compliance and mask wearing. If we were at a stage where we had 95% mask adherence and strict physical distancing and caution taken at all points of interaction among individuals within the community, perhaps our effective reproduction number would get closer to a flat 1 or potentially dip below 1. In addition to the other measures we put in and our assumed compliance or adherence with wearing masks, and we still have a growing number of infections. So anything above 1 is an exponential growth, and we're still in a period of exponential growth. So that tells us a lot about perhaps why and how this is spreading, and it leans you to look into other sources for information about that. So we have some preliminary data that shows us that people believe they were exposed in indoor residential settings when they have visited individuals from separate households. That's one preliminary data source that helps us understand, well, maybe this is spreading because of less cautious behavior, which could be reflective of we've been in this for quite a high number of months, or people believe that they're a bit safer among known contacts. But if that number, if we had full mask compliance and strict physical distancing at safe distances, then maybe perhaps, yeah, we would have a R of 1 or even below 1.
So we throw out a number of 95% with compliance and our numbers would go down. And
if that were happening, I mean.
If that were happening. So let me ask you, if that's a number that we're using, 95%, then what are we at, what percent right now?
So I think it's important not to get stuck on the specific number, but to understand the mechanism by which masks are supposed to help decrease the transmission of any type of communicable disease in the community. So it's not just that masks are panacea, and if you had 95% compliance, then you would bring that growth rate down below 1. It's that we know that masks provide some level of protection against communicable diseases, but they don't provide invulnerability. They aren't a suit of armor. You still could have transmission with a fairly high or really high level of mask wearing, but a lot of models in the COVID pandemic have projected out that if we reach that point of 95% adherence to wearing masks and physical distancing at a safe distance from others from separate households, then we are likely to see the ability to slow down the spread of the disease and the ability to maybe see a decline in this. But I think that within the U.S., we are few and far examples between that high level of compliance. So having the hard data to model that is a bit difficult.
Josh, would that require everyone in the metropolitan area at 95% compliance or just Fishers?
That's a great question. But you know, Fishers is such a unique community. Its geophysical location is very unique, right? It's within a highly mobile metropolitan area, and taking measures to help us get to a point that we can see a decline in this is dependent not only upon measures being taken here, but obviously from interactions that can happen among people within our community, from people in other communities. So I wouldn't say one way or the other that our actions are dependent on other health departments putting out similar actions or the effectiveness of the actions they have taken in place. But what I feel confident in saying is that we know from the evidence and from emerging best practice what are useful and helpful resources to decrease the spread of this within communities, and that we have tried for a number of weeks and months to share this knowledge, and I believe a lot of people received it very well and are doing the best that they can. We don't have a firm number if 95% of Fishers residents or 95% of Hamilton County residents or Indiana or any metropolitan or any other area are wearing masks 95% of the time. But that doesn't stop us from understanding what the situation is, what we believe is happening in the community, and what else we can do to help spread or mitigate the spread of this.
Thank you.
So it doesn't obviate the Fishers Health Department from needing to do additional actions that will help hopefully flatten the curve or decline it.
So in summary, masks are still beneficial. They're still a very necessary piece of this puzzle, but what the orders that we've had in place for months on the mask mandate, there have to be other places where people are not wearing masks, also contributed to the fact that we have places around us that aren't wearing masks, so they're contributing to the spread. We're not able to stay ahead of it. And, you know, even though people in the stores are doing quite well, you know, when we go, and I think that's what you're seeing, is you're saying, well, everybody in the stores is wearing masks, but people somewhere are not, right?
The absence of wearing a mask isn't the only way that this was spread, and we know that it's transmissible by other mechanisms and means as well. But I think that we are and have entered a period for which, in addition to having a mask mandate and the other restrictions we've put in place, we've entered this wildfire period where the fire is continuing to spread at a rate in which it could reach proportions that is very difficult to contain, if ever containable. And so planning and thinking ahead, what can we do to put in that fire control line to help flatten and potentially decline the spread of this within our community? And those are the measures that Monica talked about, having very clear metrics to judge against when our community gets at even more dire levels than it is now, and enacting triggered health orders against those metrics.
Any other members of the board have questions for Monica?
Hey, Monica, this is Dr. Parikh. I do have a question, actually a point of clarification. With your most recent slide, are you proposing that we pursue those restrictions, or are we waiting till the numbers pan out the way you had stated? Like, are we waiting to go with the further restrictions even more so than when we met last month?
Yes. So what we're saying is that we would put in place orders at the time period at which the county would hit that red metric, which could be next week, it could be 2 weeks from now, from the state's metrics, right? From when the county hits the red on the state's metrics, these orders would go into place. So we could write them today or tomorrow or whatever. They would go into place at that time. And then should the ICU bed capacity go to that limit, then that would trigger a 2-week stay at home. Correct.
This is Sal. Does the state have in place something like this, what you're proposing?
So the governor's orders are written in a similar way with these triggered metrics, right? And that's kind of what I went over. So with the governor's orders, even the new ones that came out yesterday, they outline what counties should do and what local jurisdictions should do when they hit these different levels. So when the county hits orange, you should do X, Y, Z. When the county hits red, you should do X, Y, Z. So those are things that they're saying, like, okay, when your county hits red, we count on the local health officials to put these things in place.
And unfortunately, I don't have the slides in front of me. So what are the proposed measures once the county turns red?
The proposed measures that I just went over. Let me see if I can. Yeah, let me share it again. Hold on. Can you see that?
Yes.
So these, like I said, these are all things that are told to us under the CDC guidelines and the state guidelines that we should be looking at in order to make the next steps. And a lot of these are the same ones that Hamilton County has selected so that we can achieve some kind of sense of consistency across our county to make sure that we're not, way out of, what the places around us are doing.
So have any other counties that are in the red, have they gone to these measures?
Yes, there are lots of them that have implemented these different measures. I would have to compile a list of them, but all the counties in these ways have kind of functioned a little bit differently, but there are many public health orders like this in place, put in place by the health officer. And that is, in fact, what the state says that we should do. They don't spell it out for us at this granularity, but they say that we should be restricting these types of businesses and opportunities for gathering. I think that was on one of the previous slides. I know it's a lot to absorb.
Yeah, it is.
I'm going to find out how to find you guys again. Dr. Lane, did you have anything you wanted to add? I don't know. I don't want to put you on the spot.
No, but I think that what's important about these triggers is that it allows the community to have for us to manage the community's expectations, right? To be able to say, to align as much as we can with what you're seeing on the state's website and our website, our Fisher site, because they aren't necessarily apples to apples, as well as Hamilton County, so that our community understands that when these things happen, we are at a dire state and we have to put, as much as we, don't want to, stronger public health orders in place to try to mitigate the spread of the virus and without collapsing the health system.
Anyone have any other questions for Monica or staff or Dr. Lane? Okay, do I have a motion to adjourn the meeting?
Motion.
Was that you, Dr. Parikh?
Yes, sir.
Okay, do I have a second?
Second.
Thank you. All in favor say aye.
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 Okay, the meeting is adjourned. Thank you, everybody.